Welcome to our NCD online course to the topic of cardiovascular disease prevention, and I'm giving here an introduction to it. One could certainly speak for a whole week, if not give a whole course, and there are courses in cardiovascular disease prevention, but I thought I'll break down this segment into three parts. I give you a brief introduction to the cardiovascular disease pathophysiology, so the biology of disease. Then we talk about cardiovascular disease epidemiology, the more public health aspects and clearly the focus of our course. And then I'm giving you a couple of examples of interventions for you to study and look up. There are two more additional resources I want to mention. One of them, throughout the presentation, you will see a reference to Salem Yusuf's article about the global burden of cardiovascular diseases. Despite it was published now over 10 years ago, I think this part 1 and there's also a part 2 are very good overview and introductory topics about cardiovascular disease epidemiology written by one of the most outstanding international researchers in this area. The other resource is the community guide associated with the Centers of Disease Control in Atlanta, but to some extent independent from them, which is a great resource for any preventive interventions. This one you should keep in mind and have handy whenever you think about what works and what doesn't work and what is the evidence in what kind of community-based interventions. Now let's start. Cardiovascular disease is the leading cause of death globally and in many countries around the world. I'm showing later you a map illustrating this. The majority of cardiovascular disease death are due to risk factors that are preventable or modifiable, and that is the good news. The bad news is bullet point number 1. It is so frequent, but the good news is we can do something about it. What can we do? Well, education on CVD and risk factor modifications is essential for efforts to reduce its mortality, but I would like to say not enough. And we come back to it. So let me come to part 1, cardiovascular disease introduction, the biology or the pathophysiology. And here you see a picture of a heart with a clotted coronary artery, but you can also imagine if that clotting happens in an artery leading to the brain or in the brain, you have something which one could call an attack of the brain, or better expressed as a stroke. And therefore cardiovascular disease encompasses heart disease and strokes. Amongst the heart disease, we are mainly concerned about the heart attacks, about heart rhythm disturbances, which can lead to heart insufficiency, heart failure, heart attacks and stroke. And as I said before, stroke is the other big sister in the cardiovascular disease. The third leading cause of death amongst Americans. I highlight Americans here because you would have thoughts that NCD's cardiovascular disease might be under control in this country, but it is not, and so it is not in many other countries. Let me highlight here, and I'm not going much into clinical science and treatment at all of them, but let me highlight here the warning signs of a heart attack: chest pain, arm, stomach pain, neck pain, feeling sick to your stomach, and so on. I want to emphasize with that some of those signs are actually quite unspecific. Feeling sick to your stomach would not get you thinking of a heart attack necessarily straight away. And that is one of the problems of heart attacks, but of many NCDs, that the symptoms are quite unspecific and might not lead to an early action. Whereas in all of them, the earlier we intervene, and we talked about that in earlier sessions, the better it would be. Hence, we talk about early identification, screening of people who are not suspecting they already are at high risk for heart attacks. Then I said also something about rhythm disorders belonging to cardiovascular disease. The most common one are the ones of the atrium, atrial fibrillation, and those of the ventriculum, tachycardia, too quick heart rates generated in the main chambers of the heart. Those are the ventricular chambers, and there are many others. Those ones can lead or be early signs of heart disease, lead to a heart attack, or increase the risk of a stroke. Therefore, they are important to note. And we mentioned also heart failure. That is basically when the heart is not meeting the needs of the body, and a typical consequence after a heart attack if the muscle, the pump, cannot squeeze sufficiently anymore. And that is quite often also seen in elderly and women, and goes hand in hand with swellings of the leg, fluid retention in the lungs, leading to problems there too. And as way of introduction, the other big sister of cardiovascular disease next to heart disease is the stroke, which is showing its first signs in some neurological defects, weakness, paralysis, vision changes, difficulties with the speech, a loss of consciousness, and things like that. And that can be either due to what we call ischemia, so then we have a lack of blood supply, or due to hemorrhage, bleeding into the brain. And there's a mini form, the mini stroke transient form, which lasts less than 24 hours. Those are mini emboli and attacks, and can be also an early sign of an imminent larger stroke. So a good warning sign to trigger action. Let's look at the key risk factors for CVD. And many of them we already discussed and you've seen in other sessions. High blood pressure or hypertension is one of the key risk factors. Diabetes, elevated blood cholesterol, and there we are mostly concerned about LDL, the so-called bad cholesterol, or too low levels of the good cholesterol, HDL. But then also tobacco use, obesity, physical inactivity. Those are the key modifiable risk factors of cardiovascular disease. Now you might ask yourself, why do I single out those 4 factors? And actually I'm leading into that a slide I got from a health coaching agency, from Tekisa Walker, a health coach, promoting lifestyle change, and quoting in her sessions George Bernard Shaw, who said that progress is impossible without change, and those who cannot change their minds cannot change anything. As much as I admire and think it's important to enable people to change their lifestyle, I think this is not sufficient, and might, if one focuses exclusively on it, might actually give also the wrong impression that it is only up to the people's lifestyle if they want to prevent or not cardiovascular disease. Now this is the last slide I borrow from the Good News, pointing out again that on one side I agree with the message. The patterns of this world are dominated by fast foods, highly processed foods, by sedentary leisure behavior, sugar-sweetened drinks, and tobacco smoking, as we see on those pictures, whereas we should all change to be more connected to our health, to our families, drink more water, eat more fruits, vegetables, read the Bible, but I think it's not the only book one should read. I think that is a representative of being more spiritually connected. Also a very good advice. Things one can do on their own, but if you think about looking at those pictures, salt in our diet is a very good example which does not quite fit into this call for individual action. Because as you see then later in the presentation, the main source of salt in our diet is actually symbolized in this picture. It is manufactured, produced food, not something we actually add, if that's the salt jar, add to our plate. So how, when emphasizing on renewing our actions, focusing on the right things, how can we reduce our salt consumption if we haven't put the salt into our food directly at the first place? It is more difficult and requires more than only individual action. That is my point on it. And with that, I'm coming to the epidemiology component of cardiovascular disease.